Okay, just so we can respect our time and have a lengthy discussion following our presentation today, I'll go ahead and get started. So good afternoon, everyone. Thank you for joining us today for our webinar, Beyond Stigma, Strength in Connections, brought to you by the Canadian Public Health Association as part of the Normalizing Conversations project. I appreciate everyone taking the time to be here today. I recognize that 2 p.m. is sort of an odd time for a webinar, but we have panelists from different time zones joining, so that's quite exciting. My name is Alexi Kim. I use she, her pronouns, and I'm a project officer with CPHA. I'll be introducing and moderating today's webinar. So before we begin, we want to acknowledge that the Canadian Public Health Association's office is situated on the traditional, ancestral, and unceded territory of the Algonquin Anishinaabe. They have been the guardians of this land for millennia, and we're grateful to be able to live, work, and learn on these lands. We recognize that working towards reconciliation goes far beyond this acknowledgement, and while CPHA is making strides to embed truth and reconciliation in our work, we really encourage you to learn more about the land you reside on and find opportunities to learn from Indigenous people and communities across Turtle Island. I myself work for CPHA, but I'm joining from Tiohtià:ke, which is Montreal, and the traditional territory of the Kanien'kehá:ka, which has long been a site for meeting and exchange among many First Nations. So I recognize that I'm a guest on these ancestral lands and that the struggle for Indigenous rights is really deeply connected to the work that we do. Along with that land acknowledgement, myself, CPHA, and the panelists here today would also like to acknowledge the trail of loss and heartbreak left in the wake of our country's ongoing drug poisoning crisis and public health emergency. Since 2016, Canada has lost more than 38,514 people to opioid-related deaths, and data from early this year show an average of 21 deaths per day. As we work today to erase barriers to important and life-saving medications, and more specifically, we'll be discussing the impacts that stigma may be experienced from or by families, friends, and peers of people who use opioids. We invite you to take a moment to remember those we have lost and those who grieve them. We'd like to recognize the individuals represented in this data, as well as those who aren't represented in this data, but who continue to be harmed by our toxic drug supply and drug policy. So our thoughts are with these individuals, their families, and their communities as we strive to do better. A few quick housekeeping notes. So we really value and encourage attendee participation. We really look forward to hearing your perspectives and questions today. We have a great set of resources that we hope people will want to use and bring into their personal work or their professional work. So if you have any questions for our presenters today, please type them into the Q&A box at the bottom of your screen. So you'll see two boxes. One is chat, one is Q&A. Q&A is a great way to share your questions. That way all the panelists have access to it and we can address them towards our discussion period. If there's any technical difficulties, again, feel free to type them in the chat and my colleague Kelsey will attend to those. We'll also be dropping links as we present to different resources, different engagement opportunities. So those will be dropped in the chat as well. Second note is that the webinar is being recorded and will be made available on CPHA's YouTube channel and on SURE, which is substanceuse.ca, a few days after our presentation. And that will also include transcripts for anyone who would like closed captioning. And finally, we'd love to get your feedback. So after the webinar, please take a minute to complete our survey. It's going to open automatically in your browser once you close Zoom. And this feedback will not only help us make these webinars what they are and give us a sense of what topics you want to learn more about, but will also inform the kind of resources that people may dedicate their energies to in developing in the future. So to provide a little bit of background, in 2020, CPHA was funded for the project titled Normalizing Conversations, Engaging Public Health, Public Safety, and Communities to Build Capacity for a Public Health Approach to Substance Use. So that is a handful of words, but basically The project has involved working with communities across Canada to publish resources that can be utilized by professionals to implement a public health approach to substance use. And with that, we've also created and made regular updates to the Canadian Substance Use Resource and Knowledge Exchange Center, which is what we call SURE. And you can find more information about SURE at substanceuse.ca or by signing up for a monthly newsletter, which Kelsey will drop in the chat. So recent resources we've created have included an organizational assessment tool for substance use stigma, as well as a challenging structural stigma workshop, which will be launched early next year. So definitely stay tuned for that. That will be a turnkey workshops that organizations can take on and deliver in their own staff and communities. And finally, a public health approach to substance use handbook. And as part of this project, we've also held webinars and knowledge mobilization opportunities. And we held a webinar last year for the first Beyond Stigma video. So we're really looking forward to having some of our previous panelists back and new panelists that were involved in the third and most recent video. So that leads me pretty well to our panelists. We have a wide and very knowledgeable panel today. So I'll begin with Abhi Sood. Dr. Abhi Sood is a physician and health services researcher in Toronto, Ontario. He's an assistant professor at the Temerity Faculty of Medicine at the University of Toronto and research chair, primary care and population health systems at Humber River Hospital. His clinical research, education, and advocacy work focus on the complex intersections of chronic pain, mental illness, and opioid use. Next, we have Sean Patnode. Sean is an artist, educator, and mental health advocate who has worked at CAMH since 2014 in roles focused on restraint reduction, patient safety, and incident management. He is a graduate fellow of Let's Lead, Yale University's Transformational Leadership Academy, and Sean has served on faculty at CAMH Education's Opioid Agonist Treatment Training Program. He is a member of the Canadian Research Initiative for Substance Misuse, also known as CRISM, and has been a guest lecturer at the Leslie Dan Faculty of Pharmacy and the MAD Studies program at the University of Toronto. Next, we're going left to right here. Next, we have Angie Hamilton. Angie is a retired lawyer, the executive director and co-founder of Families for Addiction Recovery, also known as FAR, and the parent of a child who struggles with addiction. Angie is a member of the policy committee of the Canadian Society of Addiction Medicine and a board member of the Ontario Family Caregivers Advisory Network. She was of the National Board of MAD Canada from 2014 to 2020 and the chair of their Public Policy Committee. So thank you and welcome, Angie. Next, we have Jacqueline Myers. Jackie is a pharmacist in Regina and has practiced in various clinical settings, including community pharmacy, long-term care, and within the Saskatchewan Health Authority in areas of internal medicine and opioid stewardship. Jackie currently provides care for people living with HIV as well as substance use disorders and delivers education to primary care physicians and clinicians with RX Files academic detailing service. Her passion is working with marginalized populations and helping other clinicians provide better and compassionate care. And when Jackie is not with patients or healthcare providers, she enjoys running, traveling, and spending time outdoors with her two pups, one of which is adorable, and we can see there. Next, we have Pauline Ingber. Pauline has been a public health nurse at the regional municipality of York since 2001. Her current work includes the development and collaboration on the Opioid Action Plan for York Region, and she co-chairs the stigma reduction group of the Community Opioid Drug Response Collaborative. This group is a group of community agencies that are working together to decrease stigma, harm, and marginalization of people using opioids by sharing information and providing education in order to increase awareness and appreciation that opioid and substance use are health and social issues. Pauline also works with other committees and groups to reduce stigma and harms and provide prevention strategies related to substance use in the York region. So when not at work, Pauline enjoys time in nature, hiking, traveling to new places, and spending time with family and friends. And last but certainly not least, we have Kirsten Dixon, who graduated from the School of Medicine at Queen's University in 2006 and completed her residency in family medicine through St. Michael's Hospital at the University of Toronto. Dr. Dixon's clinical work is focused on the care of people experiencing homelessness, mental illness, and substance use disorders. She works with a shelter-based outreach team through CAMH and was the lead physician with Inner City Health Associates for Seton House Men's Shelter from 2017 to 2020. Since 2015, Dr. Dixon has worked with the Safer Opioid Prescribing Program at the University of Toronto on course development and facilitation, and she's dedicated to enhancing education on opioid use disorder and improving the quality of care delivered to people who use opioids. So clearly a very passionate, a very experienced, and a wealth of expertise is present here today. So I really hope that participants will be not feel shy to ask any questions and engage with our panelists towards the tail end of our webinar today. So with that, I'll pass it over to Abby, who can speak a little bit more on the Beyond Stigma project and introduce that for us.
Thank you so much, Alexi. It's such a honor and privilege to be here. And it's been great working with CPHA and Alexi and Kelsey and others in actual development of this third video in our Beyond Stigma video series. So as has been mentioned, this is the third of the videos that we produced. The first two, the first focus, and you see still there on your screen on the left from the first video, which was focused on treatment of pain in the context of opioid use disorder. And the second video, which was known as titles Nurturing Circles of Care, focused on the intersections of pregnancy, indigeneity, and substance use, and to really identify some of the challenges driven by stigma that certain populations in our country face. And as you can tell, maybe you can see we don't take on easy issues, and but that's part of the point, is that stigma from our lived experiences, from our clinical experiences, from some of the research that we've been involved in, from all these different sort of points of view, is so entangled with how much of how we see and interact with the world, especially as it relates to substance use, and in the case of the Beyond Stigma videos, opioid use. And so if you want to go to the next slide, Alexi, we realized early on that we needed a process that could capture all these different points of view and really point the finger not at each other, but at our systems, and how our systems of care and our systems of supporting people who use substances sort of capture and embody that stigma. And are there ways that we can work together from different points of view to dismantle that stigma? And you see that in these stills for these pictures. We really try to communicate that, stigma impacts so many different ways of living with substance use, but that there are many different perspectives that can be helpful in shining a light on stigma. And so we tried to, as much as possible through these videos, have all of those, and this sort of speaks to our process of development of the scripts and the animation, really speaks to a process of trying to have all the voices at the table. Sometimes when we have these sort of public education campaigns, sometimes there's a recommendation to say, okay, well, we need to focus on a particular audience. What's our messaging going to be for clinicians? What's our messaging going to be for people who use substances? What's our messaging going to be for peers or for family members? And what we felt pretty strongly was that, no, there's a common thread that holds all these different viewpoints together. It may not be so obvious at first, but if we work together at it, we can sort of uncover those common threads. And so that's why we needed to have Pauline and Sean and Angie and Kirsten and Jackie, Alexi, Kelsey, and others at the table at the same time, so that we could make those perspectives visible and find that common thread. So I hope that, you know, when you see the previous videos as well as the new video, Strength and Connections, you'll see that kind of reflection. If you want to go to the next slide, Alexi, and that was, you know, I would say particularly challenging in Strength and Connections, which was focused on stigma and its relationship to friends, peers, and family members. And obviously that's a very sensitive subject because, you know, very much like the relationships that people may develop with clinicians, these kinds of relationships can be important, life-sustaining, or sometimes not so life-sustaining kind of relationships. And again, the hope was not to point a finger at a particular role or a particular person in somebody's life, but really identify how stigma, as captured, and you'll see, you know, we really tried to think about how do we externalize that idea of stigma, and how it's come out in the videos is the stigma monster, which you can see sitting on the shoulder here of the protagonist. And, you know, we really felt that coming together, and that we hope that that's captured in the title, Strength in Connections, could really sort of scare off or melt away that stigma monster in the context of these relationships that we have with family members, peers, and friends. And so that's what we really tried to capture with Strength and Connections. And I'll pass it back to Alexi.
Thank you so much, Abby, for that introduction. I'm really excited to move on and be able to share this video with the group. I know that we've promoted it in the past weeks, but I think this gives us a great opportunity to watch it all together and see this beautiful work being officially launched. So with that, I will share the video.
Previously in this series, we focused on how stigma operates in medical settings and made recommendations for how healthcare professionals can provide better care for patients with opioid use disorder. Now we will look at how stigma and misconceptions about medication impact people in other aspects of their lives. Imagine you've recently started methadone as treatment for opioid use disorder. Your doctor was encouraging, and you feel optimistic about your recovery. You meet up with a friend to share the good news.
And they said I qualified. They're gonna start me on methadone. Gonna get high.
Wish my doctor would give me the good stuff.
It's not like that. I'm trying to get better.
Sure, whatever, man. Heard that before.
You feel misunderstood, so you head to your recovery meeting, hoping at least they'll understand.
I finally feel like I'm making progress.
Methadone is just another drug.
It doesn't count as recovery. You're gonna get hooked.
Told you so.
Please, we don't discuss medication here. This group is for people who are trying to stay off drugs.
Discouraged, you head home. This morning, you'd been feeling so hopeful about your treatment, but now you're not sure. So you call your mother, looking for some reassurance.
Anyway, the doctor said this would help. Just switching one drug for another. You're going to lose your kid.
And isn't this all really your fault?
Be careful. I heard you can overdose on methadone too. I'm so worried about you.
Yeah. I gotta go.
Oh, okay. I love you.
Love you too.
Now you're more discouraged than ever. You thought you were making the right choice for your health, but now you're not even sure this treatment will help. You know stopping cold turkey will be hell, and returning to using could kill you. You don't know what to do. So what could have gone differently? None of your friends, peers, or family meant badly, but they all held some common and stigmatizing misconceptions. Medications like methadone aren't for getting people high. Rather, they decrease cravings and withdrawal symptoms.
I wonder if something like that could work for me.
Methadone treatment is not the same as using.
Congratulations, that's a big step.
And medications for opioid use disorder significantly reduce the risk of death.
Oh, that's wonderful news.
Told you so.
When medications for opioid use disorder are stigmatized, people can start to doubt their treatment plans. And this can be dangerous. By fighting misinformation, we can ensure that people are supported and get the treatment that is right for them.
Thank you for watching, everyone. I'm going to pass it back to Abby on the discussion guide that is related to this resource.
Thanks. So the previous videos, Beyond Stigma and Circles of Care, have been used quite widely to engage in discussions around stigma. And in order to support that, we've developed discussion guides that can be used to facilitate discussions around stigma as it relates to opioid use, and particularly to the content with a video. And they're sort of great accompaniments if, for example, you want to use the video in your institution or educational context or wherever it may be, to support some discussions. These have been used. Actually, we found out recently from folks at Health Canada, even internationally, to support some discussions. And if you want to go to the next slide, Alexi, just to give you a sort of sneak peek into the discussion guide. So we have a series of key messages that we were trying to convey in the videos. Of course, there may be other important takeaways that you may have on watching the videos. And then we also have a series of sort of discussion questions and suggested activities that can be used to help to reinforce and further explore some of the key messages. And the full discussion guide is available on our website at subjectmatter.ca, on the same page where the video is. And the video, as well as the discussion guide, are available fully translated into French as well. And so these can be really used across the country.
Thank you, Abby. Yeah, we've heard really great things about the discussion guide being used. We were previously, or last week at CCSA's Issues of Substance, and the Beyond Stigma videos and guides really came up often as a great way to address some of the content in the videos without further stigmatizing or falling into stereotypes or misinformation. And just to kind of highlight some of the key messages that are in this video, we've presented them here on the slides, and I think our panelists will be excited to expand on some of the ones that are close to their heart and to their work. But some of the key messages that were developed for this one include OAT not being a replacement. Notice the replacement in quotes for other opioids, the treatment of opioid use differing from the treatment of other substance use, OAT not being the only step in a person's road to recovery or even, treatment plan. Problematic opioid use carrying significant risks, including death. Another important one that we highlighted and we discussed at length was that success might look different for everyone depending on where a person is at on their journey to recovery. Point 6, empathy, understanding, and compassion, including self-compassion, being critical to recovery. And finally, not last but certainly not least, friends and family need support to give support. And those are really important key messages. There's a lot to unpack there, which again justifies why a discussion guide is such a valuable and important resource for folks. So thank you, Abby, for your presentation. At this point, I'll invite our panelists to come back on camera to start our discussion question. I'll stop sharing my slides so we can all see each other and engage in that discussion now. The first thing I want to say is we have a panel of people representing a lot of different perspectives and lived experiences and expertise, all of which have played, key roles in creating today's resources. So to maybe set the stage or break the ice a little bit, I'll throw this question out to the group at large. How does it feel to be watching the video today? And can you tell us a little bit about your work and maybe why you chose to become involved with the project itself? I'll pass it along to who feels comfortable. Let's start with Pauline.
Okay, thank you. Well, I'm thrilled to see the video launched because I've had a chance to use the first 2 videos with community members, internal partners that I work with, as well as the public. And I've only had good feedback and great conversations. So it's made me really thrilled to see that we could do anti-stigma work with the videos showing the message and the guidebook asking the questions and bringing reflection on. I was really thrilled to be able to join the Beyond Stigma team, and how that happened was that we saw the first video at my work and we shared it with the stigma reduction team I work on and really liked it. And then we had some questions and thoughts and ideas, and we were able to come back to the subject matter health research lab team and ask some more questions. But we also wondered about the key messages and what wanted to be said and the different intersections. So kindly, the group that was already working, had completed the video, was willing to think about a guide. So they invited myself and a couple of others to join. So that was my first opportunity, and it meant so much to me to be able to be involved with the project team and get those messages out and written down, because for some people that really helps and it's great learning. And then the second video came out, which was incredible, with the topic. And then I was invited to be in the third video working on it with this group. So that was a really great chance. So thank you.
Thank you, Pauline. I agree. It's such a wonderful complementary resource to have the discussion guide. I can maybe pass it along to Sean. I know that you're nodding over there. How does it feel to be watching the video, and why did you choose to get involved with this?
It was so cool to see the finished result. I had only seen the almost completed draft version that had come out, so this is my first time seeing the polishing, and I really have to thank the animators for their really thoughtful interpretation of the sort of guidance and topics that we gave them. First of all, I think that they really told the story with pictures in a way that really supported what we wanted to say. This was my first Beyond Stigma video. I came to it as someone with lived experience and also someone who has worked with people in various different stages of opioid use and other things, and anything that can be taken out of the way of somebody just getting to some help, whatever it is, because it's so, like, the unregulated supply is so unsafe nowadays that I really feel strongly about, like, just knocking down barriers to any treatment that works. And I think a lot of people still, you know, people my age who've figured out how to use a computer, and even older, like, we still have some of the old, like, alcohol ideas in our heads where it's like, just stop drinking for a couple of days and tough it out and you'll be fine. And that doesn't work with what's on the streets anymore. So really getting people access to things that are going to help make their lives better, and certainly help make my life better, was a prime motivator, and I'm thrilled to have been able to do it.
Thank you, Sean. I can maybe pass it along to Angie, Jackie, or Kirsten. How did you get involved, and what are your thoughts on the video today?
I'll jump in. So just a reminder, I'm with Families for Addiction Recovery, and there's a history of addiction in my family, and I have a child who struggles as well. And so I wanted to get involved for a few reasons. And, you know, it was important to me that we didn't just go from, like, removing stigma from the user and put it on the family, you know. And I have to say, you know, families go on parallel journeys of recovery with their loved ones. We're not recovering from substance use. We're recovering, you know, from understanding really that we don't get to control this, and we have to learn how to deal with it. And we need coping skills, and we need to know how to help in a way that is effective and not harmful, right? And no one's perfect. So I was very interested in making sure it was realistic from the perspective of families, and also fair to families. And again, just through my journey, I do have a loved one with an addiction to opioids. And I can tell you 10 years ago, my views on this would have been completely different, right? And there's so much for families to learn. And that's what I wanted to see come to fruition here. And I love the mom's little stigma monster, right down to the, you know, the little eyeglasses she had that were the same as the mom's. And, you know, that line really hit me, and I didn't come up with it, you know, that, and isn't this really all your fault, right? Because that is the self-stigma that families are dealing with, and it's harmful. It's harmful to them, and it's harmful to their loved ones. So yeah, that in a nutshell, that's why. And I think it's a great video. Thanks.
Thank you, Angie. That's beautiful. The parallel journeys is certainly a reality. And I agree or appreciate the need for, you know, a voice that ensures that key messages are fair to everyone involved in someone's recovery. And families certainly experience a lot more than just, you know, a lot of stigma gets displaced to family members or chosen family. Jackie or Kirsten, I'd love to hear your thoughts.
Yeah, and thanks, Angie. Like, we could not have done this video without your perspective. You added so much. I've been involved now, this is my third one. I've been involved since the beginning, and this one was definitely the most out of my comfort zone in creating, because the other ones had a bit more of a medical focus. So again, as a reminder, I'm a pharmacist. I live in Regina and work with people who use substances. Abby invited me as part of these projects because we had done some previous work together when I was involved in opioid stewardship. And then I guess if you're talking about drugs, I think people want a token pharmacist in the group. So that's me. But when I watch these videos, and I don't know if any of you guys feel the same way, but with each one, when we get that first animation draft, it makes me quite emotional. One, just because of the beauty of, we go through these conversations and we talk about what we've seen and what we've experienced and the messaging we want people to know and the things we want people to learn. And then all of a sudden it's put in this like 4-minute imagery in front of us, and it's like beautiful. So there's that piece of it. And then personally, I see my patients in these videos. And the first two were very focused on like my patient that I would be treating in front of me. And as I do more and more of this work, I learn more and more about how important it is that we're not just treating the patient, but their support groups, whether that's family members, friends, everyone around them, to ensure success. So this one was especially meaningful because it highlights the importance of the connections, right? And how that can lead people to success. So I just think they're beautiful. And as Sean mentioned, like the animator is just incredible. So
absolutely. Thank you, Jackie. Kirsten, I'd love to hear from you as well as a provider. How is this topic different from the first two, and how did you get involved as well?
Ooh, those are all interesting questions. Thank you, Alexi. And I just want to I think Sean and Abby put it in the chat already, but Jackie, you're not token. You're not token pharmacist. It's really been a privilege to be a part of this group, because like I have been involved in 3 videos now, and every time it's such an amazing learning experience, and like the process of like creating something and it turning out so beautifully is really something special. I was just thinking about it as the video started. I'm sitting here at work right now. It's really nice to be able to contribute ideas about work that I spend a lot of time doing, and contribute it to something that's in such a different format than I get to engage in on a regular basis. I guess I come to this video in particular, like I think this has probably been like the most personal for me. Like I'm working mostly in the shelter system, and like in work I'm seeing the effects of substance use disorders on families. Like most of the people I'm seeing have been separated from families because of the effects of substance use disorders on families. And I also come from a family with a history of addiction, and have a sibling with an addiction, and like have lived firsthand the effects. So this has really been like a personal experience for me, something that like I think about a lot, and certainly wish probably engage more in the work that I'm doing right now. Yeah, and I mean, Angie, you said so many things so well, but that one brief like comment from the stigma monster when the mom's on the phone about like, isn't this all your fault? Like that is there's so many ideas that we try to incorporate into these videos, and that's like one idea that could shoot off into a whole other conversation. But that part really gets me also.
Yeah, I absolutely agree with that. Thank you, Kirsten. Angie, your point about the stigma monster on the mother really, highlights the fact that we don't often feel like we're doing enough, or we feel like someone's behavior or addiction is our responsibility, rather than something that we can sometimes support through or need support for. And with that, I'll pass it along to Sean. I see you have your hand raised. I'd love to popcorn that to you.
Thank you. I just wanted to echo what Kirsten and Angie had been saying, and especially about like the separation that occurs between people and their families as a result of use, of the changes it can bring around, of the changes in lifestyle that it can bring about. I'm coming to everybody from the Center for Addiction and Mental Health in Toronto, Treaty 13 land, and properly the land of the Mississaugas of the credit. And we are a pretty large hospital, and we're the only hospital in the city that has an emergency department, but we don't have a gift shop. And that says a lot about the the strain that addiction and mental health puts on the family relationship. And we do a lot of education at CAMH about how family is who the patient says it is, because so many people turn to chosen family because of those things. So I really wanted to just sort of echo that, like, families need support and need guidance because they've gone through great losses of so many different kinds.
Sean, Angie.
Yeah, Sean, you just, reminded me when I started this work, which is around 2016, I also got involved with Toronto Public Health, and I found a research paper they did. They researched people who used drugs and asked them, did you experience stigma? I think they knew what the answer was going to be ahead of time. But, and then they asked them about the primary sources of the stigma. And it really stuck with me because the number one source of stigma was families. And furthermore, I understood that, it didn't really surprise me, but it was so painful to read that and to understand the amount of work that was going to have to go into trying to change that, right? So this series of videos is just one way, but it's so important because healthcare providers generally come and go, in the life of someone who is struggling with their substance use. Families, you hope, are there for the long run. That's the goal, regardless of what's going on. They may have to have boundaries to protect their own mental health, yes, but we certainly encourage people to try to hang in there, put the boundaries in so that you can hang in there and can keep your empathy and compassion alive, because also sometimes if they don't have any boundaries, then they can get really hurt in various ways. So it's just such a parallel journey of learning, and recovery for the family members. But that stat that primarily they experience stigma from their own families was extremely painful to read, and I absolutely believe it to be true. Thanks.
Pauline, we can move to you. There's a question here for the panelists, but I'd love to hear your thoughts before we get into that question, which kind of pivots us in a different direction.
I was just going to add that when the group came up with the idea of everyone this time having a stigma monster, it seemed so obvious because anyone who was involved in the experience of being a family member or friend or somebody so close, or sometimes even a healthcare worker, but mostly the family and friends carrying that. And what spoke a lot to me is when they try to show even the instructor, who was probably a person with lived experience leading the group, whether she is or she's not, but I'm thinking that she would have to try to push her stigma monster down when they talk about medication and the experience. So whether that's coming from a personal or a group or a different perspective, but that struggle was so obvious. So I think that, like Angie was saying, with the painful feeling that families often provide stigma, it's a universal experience and challenge. So maybe this video can provide more supports and knowledge that people aren't alone in that experience.
Thank you, Pauline. That actually leads me into a question that I have, is that when we saw a specific scene in the video about everyone having their own stigma monsters, we see that happening not only with the person with that is on methadone or receiving a prescription, but with the provider and with the support group and with peers. I'm wondering what are the challenges in creating a resource that is meant to target all of these audiences? How do we find a balance? And I don't know that there's an answer, but I would love to hear if there were some challenges or kind of negotiations that had to go in, and the type of messaging that goes into this video, because obviously the audience is not only family, peers, and people with lived and living experience, but the providers that care for them. So how do we do that in a way that's not paternalistic, that is not imposing a responsibility on family and friends, but also creates room for the person living with an opioid use disorder to decide how much family involvement there is. Step away and let that percolate if anyone wants to take it over.
I'll start on it. Information. And I see that there's Steve's question in the chat as well. And I call him Steve because he's one of my coworkers and a brilliant person who's taught me an awful lot. But information, and we really just wanted to push that. Stigma comes, stigma is a word that gets thrown around so much now that it's almost meaningless. And what it really is discrimination and exclusion. And those things come from bad old ideas. And like Steve, in Steve's question in the chat, he's asking about the idea that, well, this just happens because of personal responsibility. And I think sometimes that gets reinforced these days when we see people on the streets or on the streetcar or because there aren't the spaces for people to be anymore. We're seeing more of the crisis in public. But when we look at the people who passed away, 40% of the people who passed away, and this, I was just at a talk by the coroner last week for Ontario, and so 40% of the people who passed away during the pandemic were in the lowest percentile in terms of social determinants of health and access to healthcare. But the rest of the 60% were really evenly distributed across all of the different sort of categories of income and ability. We know that people had quite a lot of people who had seen healthcare providers in the month or even the weeks before they passed, right? So the cure is a good information. The cure is good techniques, and the cure is getting, well, a cure is getting more capacity into the community so that, the hospitals just don't burn out.
Thank you, Sean. I think that segues well into Stephen's Lincoln's question. So wondering about the panel's thoughts on the contributions of the video to challenging some of the more fundamental sources of societal stigma, such as perceptions of substance users as being personally responsible for their circumstances. And I know that the video also highlights some other myths about OAT and methadone. So I'm curious what are your thoughts on how the video can challenge some of those sources of stigma?
I can go first. I mean, I think, as Abby said, we don't want to, that's what we're hoping to do, is challenge some of these more fundamental stigmatizing beliefs and policies that are embedded into the work that we all do. I think stigma puts blame on a lot of people, and that's the easy answer. And that was one of the challenges with this. Okay, well, for removing this stigma from the person, where is that going? Is that going to a family member now? Is that going to a doctor who prescribed something somewhere down the road? Like, where is that stigma? And I think I can speak that our goal is to remove that blame from these individual people, providers, family members, and lives, and take it on and put it more where it belongs, into our overarching system that is kind of causing some of these effects, and that we've seen more pronounced due to things like pandemics and housing instability and all of these other types of things. So I hope that we are doing that, and I hope that we are challenging some of these beliefs. I don't know what everyone else thinks.
Ashley, please go ahead. Thank you, Jackie.
I think it's really important, and I think the video with the discussion guide does this, but problematic use of opioids really is different from a lot of addiction to other substances, and it looks different. So and that's was part of my journey. Like my father struggled with his alcohol use, right? And what I learned is kind of, well, first I learned you don't talk about this outside the family, and from my family of origin. And then he told me his truth, which is one drink and I'm gone. One drink and I'm gone. So abstinence is the only thing that was ever going to work for him and many other people, I think, particularly to substances other than opioids. My journey was I remember first learning about Suboxone, maybe 2016, 2017. And at first I thought this was really interesting. And then I just read things. I thought, oh my God, I was completely replacing one opioid for another. And I read something about how hard it is to come off of Suboxone. I thought, this is nuts. And, so I think it's important to acknowledge that it actually makes sense why people think these things about OAT, right? Like if somebody had said to my father, well, we're just going to give you alcohol to treat, your problematic alcohol use, I think he'd have said, no, thanks. And it's very, very different with opioids. And so I think that's a big part of the journey, acknowledging that this is different and here's why. And so personally, I've gone from someone who thought, well, this makes no sense, to actually having peace of mind. I sleep better if I know my loved one who's struggling with their substance use to opioids is on OAT. That's what makes me sleep at night. Even if they are going to top up with other substances, they are much better off to be on OAT. And that was also part of it. Is that true? So there's lots to know and lots to learn. And I think that, specifically with respect to OAT, that's what this video does.
Absolutely. Thank you. Beautiful, succinct answer, but certainly touches on the two of the top key messages, which I know there was a lot of discussion about OAT not being a, quote, replacement for other opioids, as well as the treatment of opioid use differing from the treatment of other substance use. I saw a quick hand raise from Sean, but I'm happy to pass it along to whoever's next. Go ahead, Sean.
Alexi was really kind when she read the messages on the slides to sort of enhance those quotes around opioids aren't a replacement. And I appreciate that because in some ways, yes, they are. And that's exactly what we want. I will feel, Angie just said it, how much better are you going to sleep knowing that someone you care for is using something that came from a pharmacy, whether that's methadone, whether that's buprenorphine, whether that's injectable OAT or Cadian or whatever, as opposed to whatever the heck was in that bag that they managed to score. And maybe from someone that they didn't know, because as long as we have an unregulated illegal supply, this is always going to be safer than that, right? So, yes, by all means, let's replace some of the opioids that are out there that Lord only knows what's in them with this. And that's what I did. And that's what helped, and I don't want to take up too much time, but there's always this, we talk even in the video about, this doesn't get people high, right? And let's be honest, especially in the first few weeks, methadone or buprenorphine can make you high, and that's okay. I mean, there's a 95% trauma history in the people we see with opioid use disorder or any of the other phrases that we use around that. If the side effect is someone's happy for a little bit, I'm perfectly okay with that, especially if they stay alive, right? So, that value judgment always bothers me a little bit, but I will take anybody's acceptance of it as long as they don't stand in the way of someone getting treatment when they want it.
Thank you, Sean. I think it certainly speaks to the possible meanings of what we mean by replacement. Certainly, replaces a certain substance, but not to the equal. They're not equals, right? Jackie, I see you have your hand up.
Yeah, I think that leads well into another one of the key messages, number 5, about success looking different for different people. And I'm glad you both said, like, I sleep easier knowing my loved one or myself or my friend or whomever is on that, because maybe success for that person is not complete abstinence at this time. As you said, Sean, people are experiencing immense amounts of trauma, physical, emotional, mental, and they're dealing with it in the best way that they feel that they can right now. And some people may not be ready to jump on a fully abstinent train and get on a medication that's going to block the effects of fentanyl or other opioids. But maybe we can decrease their use. Maybe we can get them to a place where they're relying more so on their prescription medication and no longer injecting, which has other harms associated with it, or different things like that. And I think that really then ties nicely in. We want to replace that. We may not be able to replace 100% of what somebody's using, and that may not be where they're at in their journey. And so to change how we're defining success for different people based on that individual and where they're at in their life journey at the moment.
Thank you so much, Jackie. I love that key message as well. I think that is one of the messages, one's idea of success. It can act as a barrier, or I think maybe act as a source of stigma and drive stigma, because, we're expecting a certain behavior, a certain change, and that might not be realistic. It might not be what the person wants. So having that key message included, I think, creates space for meeting people where they're at, but also addressing substance use as a continuum. And a lot of times, it can be difficult to receive a diagnosis or to get to that stage where you can receive OAT. So I think redefining success, both from from all audiences directed at this video, is really important. Pauline, I see that you're unmuted. I don't know if you had a question or something to add. Feel free to chime in.
No, I was just going to add that I agree with what everyone said. And I also think that the guidebook can add to more conversations, and a lot, I think working in this field, you get so much more information about what it's like for people and their families and the options of treatment and harm reduction. But not everybody knows the full sort of harm reduction approach or public health approach. So with these videos, hopefully more conversations come up. Even when I know I've shared them, it might be for people in whatever role they work in, but it's often a personal impact that people want to know more. Or like the person, Stephen, who asked in the question, and Sean had said earlier, we're seeing more people in the public and what it's like. So I think having an increased knowledge on treatment and harm reduction services and opioid agonist therapy can help people in general with the key message of increasing empathy and understanding and compassion, including self-compassion, are critical to recovery. Because while we do all of that, then we can reach out to people and hopefully meet, like you said, Alexi, meet people where they're at and provide them the support at that moment. And if treatment provides them to feel more stable in order to in order to fulfill their life, be able to go to work or school or whatever they do in their lives, and get on track, then that's incredible. And then working with people and having that empathy and understanding might open the door for more conversations and other services or wraparound services, or making people feel less alone, and opening the door for where people are at that moment, and building relationships with either family or friends or healthcare providers that provide that empathy and understanding. Hopefully makes the person feel that they can reach out.
Absolutely. Thank you, Pauline. I guess I do have a follow-up question for you, is that you're a co-chair in the stigma reduction group. I'm curious to know how you've been using the video or the guide with different groups, or how you've integrated these tools in your practice. Because the video is called Beyond Stigma, and I think a big question for a lot of folks is, how do we move this sort of messaging into programs or public health messaging or that sort of thing?
The video has been extremely helpful in my role as co-chair for a stigma committee here in York Region. Members of our committee include social services, public health, treatment services, peer support organizations, harm reduction organizations, shelters for adults, youth, school boards, first responders, including paramedics, fire, police, social justice, post-secondary, and Indigenous health center staff. So this being able to share the video with the committee is great, because we've been able to get feedback from that group, and they can also take it forward to their own organizations and their own clients. And so that's one way that we've been able to spread it further. Also, I've been able to use it in general stigma reduction trainings, as well as opioid awareness and naloxone trainings. And that has provided lots of conversation and greater understanding and compassion and interest in anti-stigma work and treatment, and just knowledge about the treatment, like was mentioned earlier. Been able to share it for external partners, for example, at shelters and at libraries and at community tables. Recently, the newest video was shared at a group, and then at our group, the stigma reduction group. And what came out of that conversation was that they would like to create a resource here that'll show more wraparound services. So let's say a mom or a person experiencing it, or whoever it is, parent, what groups and services can we actually refer that would directly impact their wellness and health? So coming out with more of that clear. We've been able to share it also in healthcare professional newsletters, community contacts, as well as our webpage. We refer also to the Health Canada Stigma Gallery, and it's also going to be on that webpage, is my understanding. I also just wanted to share that recently, when it has been shared at a shelter, people really related to the mother and the parent role. They related to the piece that at one point they were the child speaking to their parents and what that relationship was like. But then for others, it's also, they have that double role. They may also be a parent, and what's that like, and how do they cope with either treatment or their relationships, and understanding more of the stigma, and just talking about their own experiences. There was great feedback talking about the visuals and the images that really provided deeper conversation about family support, and very impactful about the mother-child conversation and the parenting theme. So, which I guess makes sense. They also said that it helped very much for people to understand more about opioid agonist therapy and the challenges, in getting it to start with their treatment to be well and to get to where they want to be, but also to the challenges of getting the carry-ons. And then I think the group would really then understand and empathize with the hard work and effort they've made to their wellness, and sort of be able to support, because for some people it's more of a mystery if people don't know the details of the treatments. And so
that's amazing. Thank you so much, Pauline. It's really nice to see it being disseminated in that way. It's beautiful to have it launched and on the subject matter website, as well as the substanceuse.ca website. But I think a great asset of this resource is obviously the visual appeal, I think, and we get a lot of stigma or stigma reduction content that can be quite dry, or doesn't really or narrate the experience of different groups. And I think the discussion guide in having key messages, having activities also encourages like critical reflection, which is something that people with, misconceptions or stigmatizing beliefs, it's a great learning opportunity for people rather than just being told, well, use different language or actually this is that. Like, I think there's a certain added benefit to doing that exercise and having a resource beside you as you watch the video, and for facilitators to make sure that these, you're getting the most out of the messages included in the video. I guess I have another question for the group, which is what are other ways we think that this could be, incorporated into programs or clinics or public health initiatives? Maybe not, the video or discussion guide specifically, but some of these key messages, do you have examples of other really important work that touches on similar issues? I find, to me, it's one of the first resources I've seen that is so targeted to friends, families, and peers of people who use opioids. Wondering if there's any other work in that same vein that you're aware of.
I just put in the chat, and I got to put a plug in for it. The wonderful folks at our simulation center, I had the privilege of working with them on a virtual reality training on how to respond to an opioid overdose with naloxone. And we have two versions. One is sort of set in a healthcare setting that teaches the injectable, and one in the community that teaches the nasal or Narcan formulation. And it's all about, again, like getting that information out to people, letting them practice, letting them feel comfortable, so that, because I think a lot of us, like, we have these kits and we look at the expiry date every once in a while and we hope we never ever have to use it, but we're scared of, will we know what to do if we do? So get a naloxone kit, get trained, especially if someone that you love or just care about or care for uses opioids in any way, or actually any drugs, because we don't know what's in the supply right now. Just get a kit, learn how. It's really, really easy, and you'll feel better. It's just like learning CPR.
Speaking of just really quick on that, I appreciate, and I don't know if you've seen this in other provinces, but in Saskatchewan, some like first aid teachers, like when St. John's or whatever, are including now naloxone in their first aid training when you learn CPR and things like that. So I appreciate that, just normalizing it as a skill that we should know.
Absolutely. I see there's a hand up in the audience from Karen Weller. If you would like to unmute, should allow and ask your question, please feel free to do so. I've allowed you to unmute. And if it's an accidental hand up, then no worries. I can lower it for you. So I'll just give you a second if you'd like to chat.
It was accidental.
Perfect. Thank you. I will lower your hand for you. Amazing. I'm curious to know a little bit more about the last message in our key message that we had developed, which is that friends and families, and I could extend it to providers and health and social providers, need support to give support. Can we talk a little bit about that? I think it's one of the sub themes in the video, but not one that is explicitly mentioned. And I think we have great expertise here. Angie, please go ahead.
Yeah, I really want to address that because that's frankly what Families for Addiction Recovery is all about, right? And our organization was founded by parents who have, young teenagers who are struggling with addiction because the needs of our families weren't being met. And what we do is there's a book I want to recommend to all family caregivers, which is Beyond Addiction: How Science and Kindness Helps People Change, by Jeffrey Foote. And it's based on something called the Invitation to Change approach, which is all of our peer supporters have been trained in it. And there's some key concepts like ambivalence and behaviors make sense. Those are the things that really made it stand out to me versus, other other programs. The idea of ambivalence, that, you know, people actually are using substances because they get something out of it. Because to family members often, like, right, we just really see the harms, and we kind of don't, I guess, you know, when it's clear to us that the harms exceed the benefits, we don't really care about the benefits. We just see the harms and we think this is crazy behavior and just stop. And it really helps to be able to get into the shoes of your loved one and understand where they're coming from and why they're doing it. And it does make sense because it's doing something for them. And sadly, this horrible illness, if they develop that from their substance use, means that what they have sometimes relied on as their major coping skill has now become their biggest problem. Like, how awful would that be, right? And sometimes, of course, the behaviors are hard on families, and it can drive families apart. The families are filled with fear, and then they respond with anger. And anger, you know, we validate it and then tell people, and it makes everything worse. This is, you know, like, this is not going to help at all. We get it. We've been there. We've been angry too. And it just doesn't help anything. It will make it worse. So here are like the concepts of boundaries, right? And not to punish your loved one, to protect your own mental health. And if you do that, it allows your empathy and compassion to flow, to always remember that there is an illness involved here, you know, and that that's what allows families to stay engaged, even in the face of what other people would say. Why do you put up with this behavior? Or, you know, just kick them out. That's, you know, you're just enabling all this judgment on family members that are trying to do their best, right? So there's a lot families need to learn. We need to get educated about the illness. There's often other illnesses that go along with it. We need to get educated about that. And we need to learn empathy and compassion for them, but also empathy and compassion for us. And what I've learned, I think that's the hardest piece, is the self-compassion for family members. It's like, that's the bottom of the list. It's like, my loved one's going to die. Don't care about having a bubble bath. Just tell me, you know, how to fix this, or how to make the biggest difference, or how to support them in an effective way. And of course, self-care is important, because you got to put on your own oxygen mask first. And we are the most motivated part of the healthcare team, and we're generally free. So the medical community needs to learn how to support us and use us as much as possible, because we love our people. We love our family members. We want to do the best. We often have no clue, like, you know, we do this for a living. We do that for a living. We might not have had any experience with this before. We don't know what we're doing, and we're eager to learn and eager to help. And sometimes in the face of all that, we face our own stigma and the door gets slammed. And, you know, so I think it's really important for service providers to also learn how to encourage loved ones to involve family members if at all possible, if safe, right? And, you know, other families can help them understand addiction better and understand how to support their loved one better. You know, there's no guarantees, but you know, what we try to do is live our lives so that, you know, if God forbid tomorrow our loved one's gone, we will not regret anything we said or did or didn't do or say today. I hope that answered the question. I got a little maybe off topic, but
it answered the question, and it did it so beautifully in such a touching way. It is incredibly hard work, but not hard because of the individual, because it is a balance of so many conflicting thoughts and opinions from, you know, the outside world. There's so much stigma that is placed on families. So I really, really appreciate that response, and specifically the point about compassion being so difficult, but very important. I'll pass it over to Sean now.
Or you're getting tired of saying that, but Angie, like, one of the best things about working on this particular project actually was some of the learning that I did with Angie, and maybe even she did with me, about how similar some of our experiences were, me coming from the place of the person who had been using, and her coming from the place of the family member. And when she said, you know, about the self-compassion being the hardest part, and that resonates so strongly with me. I mean, the one of the things I loved about the Stigma Monster is that, you know, walking around with an addiction, or however you want to phrase that, walking around with a problem, you know, with problematic use, it's like having this big bag of secret that you can't share with everybody. So you're always coming from a place of hiding from the world, and you're always judging yourself 3 times as hard as everybody else is, even, and learning to have compassion. And I'll throw in a plug for Gabor Mate and In the Realm of Hungry Ghosts, which was actually the book that started me on a journey of discovering a little bit of self-compassion, but it's still hard. And it takes some support.
Thank you so much, Sean. And to go back to what Angie, you were saying about family members, you know, chosen or biological, being part of the team. I'd love to maybe hear from Jackie or Kirsten about how that can be done. Obviously, you know, there is no one practice. Everyone is very different, and not everyone is available or willing to, or, you know, wants family involved in their treatment plan or recovery. But I'd love to make that connection a little bit between your roles and how family, you know, comes into that every day.
I can take that, I guess, from some perspective. I guess, like, as a clinician, like, it often feels, it can feel very complicated. It can feel kind of scary. You're opening up a door to, like, a whole other, like, you're already dealing with probably what is a pretty complicated illness by the time I'm seeing people, lots of complicated stuff happening. And sometimes you wonder if you're opening up a door to yet another, like, very complicated realm in somebody's life. That's not to say that we shouldn't be doing it, but I imagine that probably prevents a lot of clinicians from doing it. The other thing, though, is, like, I'm well aware as a clinician, and as a family member, like, the information that, like, to be gained from family members, the understanding of who the person is and, like, what's been happening for them in their lives is often like it's a whole new world of understanding of what's been happening for a person often. That's very helpful clinically and in trying to care for somebody. Plus, like, I mean, like, oftentimes, if it, obviously, you know, there's all the health information kind of limitations on things, but if it works out and people want to be reconnected with family and want family involved, like, it can be like a huge part of people stabilizing, of like healing relationships, restoring some, like, self-worth, and, like, the feeling that people notice and care about you and want the best for you. Like, it can be a world of difference for people. But yeah, I think probably, like, a lot of clinicians feel afraid of it because yeah, the realities of our healthcare system are that like we're not nobody got training how to deal with that. If you're not working with like a multidisciplinary team where you can get help in like managing all of that kind of stuff, and you have the time and the space to do that, it yeah, it can feel like really overwhelming and a bit scary. That's not to say that it shouldn't be happening, and as clinicians, we should be like fighting for a way to make that a formalized part of providing care for people and have support in place to do that and to bring families in and reconnect families. Yeah, so there's some practical elements to it that are really unfortunate right now, but yeah, there's huge benefit to be gained.
Absolutely. And I think it definitely speaks to some of the work that has to be happening at maybe more of the structural level and policy development level to make sure that providers, the burden is not only on families, it's not a burden, but that the responsibility is not only on providers. There's so much to juggle. So without the proper support, that is a very tall order. Jackie, I'm wondering if you have any similar thoughts.
Yeah, I mean, I feel all the same feelings and thoughts Kirsten is describing there. And I'm trying to think of tangible things that we can do within the restrictions that we currently have. And it is scary as a provider, especially as we're dealing with confidentiality concerns too, and things like that. And relationships may be good some days, and relationships may not be at that same level on other days, and navigating that. So having a multidisciplinary team is huge. That allows us in our clinic to do a lot of what we do, and just creating a space that's welcoming for everybody is also important. I think of some limitations too, like we provide like lots of bus passes and transportation to get people to our clinic, but if we don't have the funds to do that for their support member or family member, that kind of impacts that as well. If we don't have a space that's comfortable for everyone to talk, that can impact that as well too. So there's definitely some large things that can be changed, and things that need to be thought of when we're creating budgets for programs and things like that is that we need to support the supporters as well. One thing we try and think of too is, and this kind of goes to that first section of the video where there was a friend who was also struggling, and I see this all the time with my patients, that they struggle because they go back to wherever they're living or whoever they're with, and they're using substances still, and they may not feel good about where they are or where their place, and they kind of try to bring that person down with them. And so we do try to offer support to whether it's a partner or a close friend, or who is that person spending a lot of time with. And if they are also looking for like reaching out because they need assistance too, helping treat people as pairs or couples or friendships as well, because we know that's going to increase the success of treatment for that person. And those are just little things. I mean, I think in general, we can do a lot more stuff like this, as Sean mentioned, information and advocacy. I think in the video, it shows the person bringing their friend to the pharmacy and having like those conversations if that person's comfortable. I mean, we do this with HIV. When we talk about HIV transmission, we bring if someone has questions and you're comfortable, bring them into your appointment so we can go over this together and help make sure that information is clear and accessible to everyone. So not perfect, but those are some places we can start.
Wonderful. Thank you, Jackie. It's nice to hear those like little examples of barriers that we might not actually notice, like that accessibility of transport, or that building in a budget, or even time, within an appointment to be able to see two people, and make sure that the right, like Kirsten was saying, confidentiality is respected. I think as we move, I'm looking at the time. I know that Pauline, you unmuted. I'd love to hear from the group if there are any final takeaways. I think one thing that the video reminds me of is that we all have that stigma monster there with us, but there is, there is a lot of hope. There's a lot of concrete action that we can be taking, including sharing these resources. I'm wondering if anyone wants to leave with some key takeaways or something you'd like to leave the group with today.
first, thank you for coming. Like, thank you for being caring enough to come for this, and please share it widely. One thing, and maybe this can even sort of talk a little bit to Steve's question for structural, is let's look at language. Let's stop using words like crackhead and junkie and drunk and things like that, because the minute that you characterize someone like that, that becomes their entire identity, and they're very easy to just not care about. Whereas if you see the person, then you might make some better decisions, because we really hope that without stigma, people will vote for politicians who say that we're going to do more to address this crisis, that it's going to be more politically a good choice to make bold choices, you know, and we need all the advocates we can get, you know. But I find starting with language can be really, really helpful.
Absolutely. Language is certainly like a great, you know, door into this world. And I think we have, you know, a legacy of drug education that has been incredibly harmful. And I think it's going to take time to dismantle all of that. But you know, efforts like this one, and certainly all your work in advocacy are turning the tide a little bit. Angie, please go ahead.
I just, you know, I guess for the families out there, right? Because our organization, I do a lot of peer support, and oftentimes families are wondering, you know, you know, I don't know if I should do this or that, or would it be helpful if I did this or that? And you get a million questions. And more often than not, I think the right question is, have you asked them? You know, because families do tend to walk on eggshells, and I do understand why. And it's important to have, you know, sharpen your communication skills. But often the best thing to do is ask your loved one, what do they need from you? What do they think, you know, good support from you looks like, you know? So that's the main thing, ask. And then I would say it's really important to hold out hope. Anybody who's in recovery right now or working towards that, they have lost so many people. Like, it boggles my mind. I don't know how, even if, you know, you personally, your life is great, I don't know how you recover from all your friends dying. So hold out hope. If they can get grief counseling, help them with that. And hold out hope for them, even if they're losing hope in themselves, and never, ever, ever give up. Do not surrender to this disease. Do not, ever. Thank you.
Thank you, Angie. Colleen.
Thanks, Angie and Sean and everyone. I just wanted to also add, I guess in terms of the language, that has been a really big focus in our work, and also in the guide. I see there's under the resource section, the stigma, why words matter, but there's many organizations that have it, and the videos are an opportunity to come up, because sometimes when you talk about these, and whether you're using one video or two or three or different times or different parts of them and using them again and again and going deeper into the guide, the language will always come up. And I guess there are some people that don't realize how hurtful those words could be, but really not using judgmental words, but really understanding we're a person with anything that we might experience in life, whether that's a disease or anything else, but first you're a person. So, and I just wanted to also add that I've heard some really good things about the peer navigation program, and that's a structural change within hospitals where they will have a person in the emergency department where they have lived a living experience. And they will help inspire hope, provide support, be there in the emergency room, get them through. But that's also an acceptance within advocacy and change within a hospital, and changes in structure. And I think we always it's obviously most important to include family members and people with living experience. in substance use in order to change policy and change structures, to change social and public stigma as well as self.
Thank you, Pauline. Definitely agree. Coming from a public health organization, there's a lot to do and a lot of structural change that we'd like to see. Just being mindful of time, I would love to hear from Jackie and Kirsten. Any last words? One of you can close us off for today.
Did you want to go, Kirsten?
Sure, I'll go ahead. I don't have anything to say other than just thank you to the panel members. You guys are amazing. It's really been a pleasure. I've learned so much from you. I mean, that's really the most I can say right now. Thank you.
Yeah, I agree. I just want to say thanks. This has been such a great learning experience. And I'm guessing a lot of the people who are attending are probably invested in this work somehow as well. So thank you for coming and sharing this. And remember that when you go out to like fight stigma, that people are scared, right? They're scared of this, they're scared of death and substance use. And so be kind as people are learning, and be kind to yourselves as you learn as well.
Thank you so much, Jackie. And now we have Abby. Abby, would you like to do a closing statement?
No, just wanted to say thank you to everybody for attending, and just echo what everybody else was saying. It's been a real honor and privilege to learn from everybody, and hopefully we've created a resource that is going to be useful to all of you who've joined us today.
Absolutely. So on that note, I'll thank everyone here today, both participants and panelists. Thank you for sharing this wonderful resource with us and sharing your insights and experience. The video is available on subjectmatter.ca/strength or /force in French, as well as the discussion guide, and the recording for this webinar will be made available in the days following. So I would expect it by early next week. And thank you to all our panelists once again. Really wonderful discussion, and I appreciate all the work you're doing.
Thank you all.
Thank you all.
Everyone.
Everybody.
Thank you, Alexi. Thanks for coordinating. Thank you.
My pleasure.